VBSR, you know, healthcare has been a big priority for us over the past few years. We supported the governor and the legislature as they're moving towards a public healthcare system. Right now, we're looking at the big healthcare issues next year at the Statehouse. They're probably going to be less about single payer down the road and more about how the state implements the federal healthcare reform legislation, including the health insurance exchanges. Kind of curious, who in the room is familiar with health insurance exchanges? Do you know what they are, or how much? That's okay, pretty good here. Some people out there, you know, they don't know this big change is coming and how we deliver healthcare across the country. So for those who don't know, the health insurance exchanges, it's mandated by the Affordable Care Act, which was the, also known as Obamacare, for some people call it that. So the health insurance exchange will be an online marketplace where certain individuals and businesses can go on to buy health insurance, sometimes at a discount that big business has been getting for years for health insurance. The legislature passed a law earlier this year about how we set up the health insurance exchanges, and they'll come online January 1st, 2014 here in the state. But there's a few issues that still need to be worked on over the next few years. One of them is Vermonters who are in VHAP or catamount to public health care programs right now, especially if they're on the lower income scale, they're going to face a big sticker shock when they hit the health insurance exchanges. Right now, state subsidies are for this population is pretty robust, especially compared to the subsidies that will be in the exchanges. And the subsidies in the exchanges are actually pretty good for some populations, but if you're in the lower income scale, there's a strong possibility that it could get a lot more expensive to buy health insurance. So VBSR is very concerned about that issue. We're looking at it. I've seen some estimates it may cost $18 to $20 million if the state wanted to kind of meet that gap for that income population in the health insurance exchanges. Another issue is, for healthcare reform at the Statehouse next year is long-term financing for the health insurance exchanges, the system, the infrastructure. The feds cover most of the cost for the first year, and then the state needs to take over after that. So the state's going to need to find some money to keep that infrastructure going for the health insurance exchanges. And another healthcare issue we want to interact with is initially when Vermont started making a move towards a public healthcare system or a single payer, one of the issues that the legislature was supposed to look at next year was healthcare finance, how we're going to fund a healthcare system. The legislature will get a report, I think it's January 15th is the due date, from their consultant. I'm hearing maybe a menu of different funding options, but the lawmakers are not expected to pass any legislation when it comes to funding a public healthcare system in the next biennium. You know, because right now they're looking at pulling the trigger on the system in 2017. So there's a lot of time between now and then, and so I think they'll face that question a few years from now. But with that report coming, we wanted to help guide the lawmakers, you know, give them feedback on on how we feel about the menu of options, and make sure that there's a system in place where Vermonters are interacting with the legislature and the state government as they put together a financing package down the road. So that's healthcare in 5 minutes. Another big issue for us next year is going to be renewable energy, and especially wind here in Vermont. If you followed the legislature last year, there was a lot of debate about the future of wind energy in Vermont. A moratorium on new wind energy came pretty close to passing the Senate. VBSR is a long-time supporter of renewable energy and wind here in Vermont, so we expect to go into the Statehouse next year and let the lawmakers know that we support wind, we support renewable energy. On the planning and permitting side, we do have some concerns about that, but we will make it clear, very clear, we do support wind. And next, a big issue also for us next year will be genetically modified organisms and GMO labeling. There was a bill in the House Ag Committee earlier this year during the session. Basically, it's required the labeling of all food containing GMO ingredients sold in Vermont, whether it's manufactured inside Vermont or outside the state. we'd be the first state to do something like that. California had a ballot question in November on the same issue. Everyone expected it to pass, and then you saw a lot of money flood into that campaign. I think it was about $45 million. And that was really, that money changed public perception of the GMO issue in California, and ended up losing by about 4 to 5% on election day. So, but we are going to come to the State House next year, and we do support GMO labeling. We hope the state will work with our smaller food producers right now, because one of the things I've learned is a lot of our small food producers, philosophically, they agree. Everyone should know what's in their food, and that you have a right to know what's in the food you're buying in the supermarket. But when you get to the logistical, how you actually carry out these regulations, it's much more difficult. Small producers might have to change packaging for these new regulations, or go out and find alternative ingredients for their recipes. It's kind of shocking right now because a lot of food producers are telling me that their suppliers can't tell them whether or not the ingredients are GMO or non-GMO because it's infected our food system so strongly. So people have to look for alternative ingredients possibly. And we hope maybe the state will make some low-interest loans available for small businesses if they have to change packaging or change recipes. But we do think this is good legislation that when people buy a Vermont product, they expect wholesomeness, purity, that's healthy. And if we have GMOs intermingled with products that are under the Vermont brand, that's very concerning long-term for the stability of the Vermont brand.
Again?
Yes.
Would that only, from your perspective, would that only affect Vermont-made products or products sold in Vermont as well?
Any product sold in Vermont, yeah. So that VBSR is still working on our agenda. That's probably some of the big ones we'll be working on. There's a few smaller issues. I think we'll support, there's going to be a move next year for paid leave legislation. A lot of our members right now do supply paid leave for their employees. They see the benefit. You don't want, if someone's sick or they have a mother or father or a child who's sick, they can't focus on their job. So our members do see the value in supplying paid leave, and I think it's time for this, for Vermont, all businesses to supply some sort of paid leave to their employees. But it probably won't be top of our agenda. Other groups are working on that issue, but we'll play back up on them on that, and we certainly support that. So in a nutshell, that's more or less our agenda. It's still coming together in some pieces, but that's the broad view.